had twins at 34 weeks. We had ultrasounds. They didn't find any issues. She started having issues right after birth. They heard a heart murmur. The babies were taken into the intensive care unit at the hospital. They transferred Kendall to Children's Hospital the day after she was born to do an echocardiogram. They didn't have the machines at her birth hospital. And we were told that she was born with several heart defects that would require her to have a surgery right away. She had her first surgery at 8 days old to repair 2 of the defects. She had to have her second open heart surgery at exactly 4 months after her first one. She was home for about 2 months and she started having the same kind of respiratory issues. She wasn't eating. So we brought her back in, and the only option was a heart transplant. She had no surgical options left at that point. When she was first diagnosed, we didn't know anything about heart disease or anything. So we kind of had to learn on the fly through the internet, through the hospital, the doctors explaining everything to us. It was a peace of mind knowing it was something that could be fixed.
The whole process is definitely a roller coaster. I mean, it's quite taxing on the parents, of course, but, you know, we're lucky enough to have Children's Hospital here in Cincinnati that took great care of Kendall and great care of us throughout the process to make it as easy as possible. But it's a constant battle that we'll deal with, of course, for the rest of our lives. I mean, it's something that when something like this happens, I mean, it just changes your life completely. And, you know, a lot of people ask, how do you deal with something like that? I mean, how do you do it? And I just tell everybody the same thing. I mean, it's not something that you have a choice to deal with. It's something that you just do.